I'd like to discuss with you today the potential role of birtamimab in the treatment of advanced cardiac amyloidosis. Birtamimab is an antibody against amyloid fibril epitopes that activates macrophages, and the macrophages catabolize and remove the amyloid fibrils, and therefore it functions as an amyloid depleter. Currently, all treatments that we use for management of AL amyloidosis are chemotherapy-based and are designed to destroy the monoclonal plasma cells that produce the amyloid light chain. So we're focusing on production. However, we've really done nothing at all about existing amyloid deposits in tissue. They're there, and we have no management strategies to actually remove existing amyloid, which is consequential in patients who are diagnosed late with extensive amyloid deposition before treatment begins. Our current attitude is to treat with chemotherapy and then sit back and hope that the amyloid leaves the tissues on its own, but nothing proactive. Birtamimab was tested in the VITAL trial in treatment-naive patients combined with standard of care chemotherapy compared to placebo plus standard of care chemotherapy. This VITAL trial was terminated because of a futility analysis that indicated it would not reach its predefined endpoints. However, a subsequent post hoc analysis that was limited to patients with cardiac stage 4 AL amyloidosis demonstrated that birtamimab combined with standard of care chemotherapy compared to placebo and chemotherapy resulted in a significant reduction in all-cause mortality at 9 months with a hazard function of almost 0.54, which was statistically significant for survival benefit. This post hoc analysis is, of course, insufficient to make specific recommendations, but it certainly is an indicator that a phase 3 trial is justified. And so a phase 3 trial globally has opened for treatment-naive patients with stage 4 cardiac AL amyloidosis, randomizing patients to birtamimab monthly with standard of care chemotherapy compared to placebo with standard of care chemotherapy. So it's of the utmost importance if a hematologist or cardiologist sees a patient who has not been treated, that they be given the opportunity to participate in a clinical trial that would allow them to possibly receive an amyloid depleting antibody that is potentially capable of removing amyloid fibrils from tissues. The randomization in this trial is 2 that will receive birtamimab and 1 that will receive placebo. So a 2/3 chance that patients will receive active treatment, and referral for enrollment of treatment-naive patients with cardiac AL amyloid stage 4 is strongly recommended.